to some of that. First of all, I just want to say something on the funding, because absolutely the cost of healthcare will continue to rise as we all live longer, as we discover more in medicine. Absolutely that there's always a need for more money. But in terms of what the government has put into healthcare, I mean, I fought my campaign here saying that we would put more money into the NHS, and £12.7 billion has gone into the NHS. So that is a step in the right direction, but of course it has to be spent on the right things. An additional £650 million has been spent in the Cancer Drugs Fund. Absolutely right that has been done. An additional £400 million has just been confirmed by the government for the Cancer Drugs Fund. So there has been additional funding going into the NHS. But I think and I said earlier, I wasn't an expert in NHS, so I look at this issue as if I was a patient, or if I've just been to see my mother recently who's in hospital, so about someone else that I know that is in hospital. And how I look at it is that what I want is that if I'm ill or one of my loved ones are ill, I want to be able to get to the hospital that can give me the best treatment at point of need. Now, in my constituency here, the western part will often use the West Middlesex Hospital. There is less change happening to that hospital in Isleworth. It will continue as a major acute hospital. And then, of course, here in Chiswick, more likely to use Charing Cross and other hospitals in the surrounding areas. So naturally, this is extremely important. But what is, I think, really also important to know is that what we are going to do with Charing Cross is build 2 new hospitals, Ealing and Charing Cross. Yes, they will be different to what they are today, but they are 2 new, £80 million going into both of those hospitals. But what I do want to make people give them a comfort feel is that if you are ill, if you are in an ambulance, if you are wanting to get care, you will absolutely get that in London. What I want to know is that if I'm going into a hospital for a particular, whether it's for heart disease, which, given I've got lots of heart disease in my family, may happen, what I want to know is that a specialist will deal with me at point of need, that if I go in at the weekend, there is someone who absolutely is an expert who can care for me, and that is my aim. If we can do things that can save lives and improve patient care, then that's what I think we should be looking at.
Thank you, Mary.
Yes.
Thank you very much. We'll have
Could we not heckle Mr. Macleod?
it's a lot easier if we do allow the speakers to speak, and we will give you